Olá pessoal, hoje temos o prazer de conversar com a doutora Jadranka Buturovic-Ponikvar, que é da Eslovênia. Ela é médica nefrologista e é uma das responsáveis pela organização da próxima Conferência Mundial de Bioética, que vai ser na Eslovênia em 2025. Então vamos conversar um pouquinho com ela e saber um pouco do background dela na bioética. Hi Dr. Jadranka, thank you for joining us. It's a pleasure to have you here. And at first, I would like to know about the program of donation of organs you're involved in. How does it work and how it is to work with this?
In Slovenia, organ donation program is underway as a part of Eurotransplant organization. This is organization that includes 8 European countries, and Slovenia is a member from the year 2000, so 24 years. And before that, we had our own program of deceased donation from brain death donors. And after joining Eurotransplant, we developed all organ transplantation, not only kidneys that we started in 1970, but we also added liver, heart, and lungs, and pancreas, so all organs. And we also have a program of multi-organ procurement that is led by a hospital I'm working in. This is University Medical Center Ljubljana, one of the biggest hospitals in the region that have more than 2,000 beds, more than 8,000 employees and 1,500 physicians in it, and they are involved in organization and organ procurement, and also involved in performing transplantation of all organs. And we are happy to have a good very good long-term survival of transplanted kidneys from a diseased donor that is better than European average. And we believe there are many factors why this is so. And one of the important factors is that all patients are treated in one center. This is our center for kidney transplantation. From transplantation until organ failure, kidney failure, and also 1 year after kidney graft failure. Because after kidney graft failure, these patients may be very complex, and some self-standing dialysis centers cannot have increased knowledge and skills to navigate the destiny of such patients. So we are to take care of all dialysis, of all transplanted patients from the moment of transplantation until the organ failure is possible, because Slovenia is a small and compact country, 2 million of inhabitants, and every patient may come to our center, which is in the center of the country, 1 per 3 months. And so we also communicate with them by phone or by telemedicine. And so with such close contact, we are able to assure adherence to the complex post-transplant treatment, because many kidneys are lost because the patients, transplanted patients, do not adhere to this complex treatment. And if they are left alone and only have family physician to take care of them and prescribe drugs, this adherence may be lower, and kidney graft can be lost earlier than naturally. And we are also happy that Slovenia has all the modern drugs available for patients with chronic kidney disease. So by prescribing these drugs, we are able to prevent end-stage kidney disease in many patients, so to assure these patients not to need dialysis or kidney transplantation. And for now, the number of dialysis patients in Slovenia is stable. It is not increasing for a number of years because new patients come to dialysis, but we transplant equal number or more of patients, and so we can control this dialysis population not to overburden the healthcare system in the country.
What are the communications keys and strategies to talk to the families and people to contribute to the donation program?
These communication skills are performed by Slovenia Transplant. This is a separate organization who only takes care of organ donation program. They have nothing to do with transplantation, but they have to do everything with organ donation program, and they were trained in some European countries, in Spain, for example, and in Eurotransplant countries before we joined, and they were trained to communicate with the families to allow to take organs from brain-dead donors. And they are very good in these skills. These are transplant coordinators. They are very good and very skilled, so approval to donation is very high in Slovenia, more than 80%.
And what are the most important ethical issues concerning living donation nowadays?
You mean generally in the world? I have just had a talk on this topic. I believe that important issue is to protect the vulnerable population, and that are women, children and young adults who are enrolled to donate a kidney often to their elderly, and we should follow this and we should protect them. And of course, in living donation, we are all aware that there is organ trading along the world. There is a famous anthropologist for University of Berkeley, Nancy Shepherd-Hughes, who is a director of a non-governmental organization, Organ Watch, and she assessed that 10 years ago or more that around 15,000 of kidney transplantations were performed illegally. That's why there is Istanbul Declaration against human trafficking, against organ trading, against commercial transplantation, and this is the issue this is the greatest problem of living donation, and also promotion of living donation may go too far. For example, this is reflected by the term spare kidney, as we all have one kidney to spare and to donate to someone, and we need two. As a nephrologist, I know very well that it is not so simple, but some young patients may be susceptible to this simple call, donate a kidney to anyone. And also there is a problem with organ solicitation through social media, through websites, because this way of getting organ from specific recipient who asks, please, I need a kidney, then it can turn out into some kind of beauty contest. The person that is more attractive physically or personally in any other way will get more offer for organs than the person that is not, and this kind of donation is not supervised by transplant organization. These are contracts between recipient and the donor. So these are the problems of living organ donation.
And in your opinion, what are some learnings we had from the ethical challenges faced during the COVID-19 pandemic? During
pandemic, it was a very hard time, and we have to choose who will live and who will die, and this is. And Slovenia is located very close to Bergamo, and you know there is a there was a tragedy in Bergamo when even 25 years old patients with COVID, there was a cutoff on this age. Older than that, they would not be accepted to this intensive care unit. However, we in many countries transplantation temporarily stopped during the first wave of COVID pandemics. However, in Slovenia, we have managed somehow to preserve part of transplantation that was urgent to be still ongoing, because these patients would die on the waiting list. And after surviving first and second day, it became easier later. But this is this triage we lived with, and the scarcity of everything, masks, equipment. It was very tough for healthcare workers, for patients, for society.
How do you see the balance of medical intervention and patient autonomy, some ethical points discussed in bioethics, and what could you tell us about it?
I believe, at least in high-income countries, we may live in some time of over-diagnosis and over-treatment, and maybe medicalization of life. And this we should, as a physicians and as a society, we should find some balance to offer patients reasonable care, and not to emphasize it too much. And this balance is a challenge for the next period, because you are probably aware that increasing number of countries intend to legalize euthanasia in Europe, Canada, in Europe, Benelux countries, and Spain and Portugal recently, and we are in Slovenia also in the process of discussing whether we should legalize euthanasia. It is a very big problem, and it because I believe we should avoid that and use more reasonable medicine, medical care, and also intensive palliative care and hospices.
And what about the challenges with IA nowadays in medicine?
The challenges are tremendous. They happens in front of us with unprecedented speed. Professor Nunes has fantastic talk on this, and we cannot with ethics and laws, we cannot keep pacing with these changes. And I think we should focus as physicians to preserve and trusting patient-physician relationship, even in this era of artificial intelligence coming into medicine, and also to demand from artificial intelligence to prove that it is useful. When you have dealing with big pharma, they have to prove that the drug works, and these are very expensive proofs and very expensive studies. And we should also require from big tech companies, from artificial intelligence, not just to promise this will do that, but to prove that mortality of patients is because of their use decreased or quality of life increased. This is the direction I believe we should go, and also we should inform our patients and ourselves that there is no privacy anymore with artificial intelligence, there is no privacy, and we should used to that.
And how is the organization going for the next conference?
Organization, we have already some meetings, we have already reservations for Congress venue preparing, and I believe this conference will be nice. Ljubljana is a small city, medium-sized city, 300,000 inhabitants, and it is in the very center of Europe. So it would not be only scientific part that would be on the top level, but also the Congress and hotels, they will be, everything would be on walking distance, and there are beautiful cities around in the radius of 500 kilometers to visit, and November is a time where no there are no many tourists, and I believe that as from scientific view and also from social view and maybe from tourism, it is a nice opportunity, so I would be glad that you come to visit our country and our capital.
I'm looking forward to it. And yeah, in Brazil, it was the first time in America, this conference. And do you think the country that hosts this conference has some important influence in the program, in what is discussed? It is natural that country that is organizing has important influence, and I have enjoyed lectures from Brazilian bioethicist and physician, and I have learned a lot, and it was for me a very nice experience to learn view from another country. I don't like to be locked in only in some high-income countries because some solutions with some more creative solutions may often come from medium and low-income country. I don't know where Brazil is, I suppose medium or even higher. And what are some expectations from the bioethic community in Slovenia? What they expect to show the world? Slovenia has a very long tradition of deontology and medical ethics from the early 60s when bioethics was born. And the Committee for Medical Ethics of the Republic of Slovenia was one of the first ethics committee in Europe and in the world, and it also is also existed today and review all important research studies and also give opinion on different ethical issues that are important for society. And we had two famous physicians, Professor Milczynski, who was a professor of forensic medicine, and he was also president of National Academy of Science, and he introduced medical ethics as an autonomous discipline in the mid-60s. And also we had a great professor, also president of Slovenian Slovenian Academy of Science, Professor Jože Trontelj. He was famous bioethicist, and he was Slovenian delegate in the Council of Europe, and also participated in formulating Oviedo Convention and all related documents from the Council of Europe. So we try to prolong this tradition. We also include now students from the first year and through second, third, and until graduation, medical students to learn bioethics more than we have to, because it was not so tough at that time to be a physician.
today I'm a physician for 40 years, clinical physician, still working with patients, and today it is much harder to practice medicine than it was 30 years ago, for example.
Why?
Because there is a lot of administration, there is a lot of this digitalization is frequently oriented to management and not to patients, and there is also there is corporatization of healthcare, the spirit of corporatization. There is tendency to measure physicians' efficiency by the management, and this means that you have no time to talk with your patient, and this is the most pressure element of your interaction with patients, and we physicians should fight for this time and fight against efficiency measurement, production measurement, because it can be harmful for patients, because if monitored by number of procedures, the physician could pick up easier patients, and even that are not ill, to perform some procedure to be efficient. And these are challenges of today's medicine, and these are also the consequences in this corporatization of healthcare that causes moral distress in the physician, and we should fight for more time dedicated to patient one-to-one as human beings, and not as watching to computer, and not watch to the patient in his eyes.
Okay, Jadranka, thank you for joining us, for sharing with us your thoughts, and I'm sure the next conference is going to be very successful.
Thank you.
A gente fica por aqui, até a próxima entrevista. Tchau, tchau.
Conselho Federal de Medicina. Defendendo princípios, aperfeiçoando práticas.